How is pulmonary hypertension linked to advanced CF? Imagine your lungs working overtime to get enough oxygen into your blood, especially when they are damaged. In advanced cystic fibrosis, this struggle can lead to a condition called pulmonary hypertension. Pulmonary hypertension means high blood pressure in the arteries that carry blood from the heart to the lungs. It's a serious complication that often shows up in people with very advanced lung disease caused by cystic fibrosis. Cystic fibrosis is a genetic disorder that causes thick, sticky mucus to build up in the lungs. This mucus traps bacteria and causes repeated infections, inflammation, and gradual damage to lung tissue. As the lungs get more damaged, they become less efficient at exchanging oxygen and removing carbon dioxide. This results in low oxygen levels in the blood, a condition called hypoxemia. When oxygen levels are low over time, the blood vessels in the lungs react by narrowing and remodeling, which means they change shape and structure. This process increases resistance in the pulmonary arteries, making it harder for blood to flow through the lungs. Because of this increased resistance, the pressure in the pulmonary arteries rises, leading to pulmonary hypertension. This puts extra strain on the right side of the heart, which has to work harder to pump blood through the narrowed vessels. Over time, this extra workload can cause the right ventricle to weaken or even fail, which is a serious health concern. Studies show that pulmonary hypertension is common in people with advanced cystic fibrosis, especially those waiting for lung transplants. In fact, more than half of patients evaluated before transplant have some degree of pulmonary hypertension. Having pulmonary hypertension in cystic fibrosis is often a sign that the disease has reached an advanced stage. It's linked to a higher risk of death and indicates that the lungs are severely damaged. While some treatments target pulmonary hypertension directly, their effectiveness in cystic fibrosis is still being studied. Diagnosing pulmonary hypertension usually involves a procedure called right heart catheterization, which measures the pressure directly. However, because this procedure is invasive, many doctors relying on echocardiograms or clinical signs to suspect it. There is also emerging research suggesting that the gene responsible for cystic fibrosis, called the CFTR gene, might play a role in the blood vessel changes seen in pulmonary hypertension. This is an exciting area of study, but more research is needed to understand the connection fully. In summary, pulmonary hypertension in advanced cystic fibrosis develops mainly because of chronic low oxygen levels and lung damage. It causes increased pressure in the lung arteries and puts stress on the heart, often indicating that the disease has become very severe. Recognizing and managing pulmonary hypertension early is important, but treatment options are still being explored. Anyone living with cystic fibrosis should work closely with their healthcare team to monitor their lung and heart health, as individual experiences can vary widely. Always consult your healthcare provider for personalized advice and care.